welcome to the Environmental Justice Lab. I am your host, Dr. Leslie Joseph. Thank you so much for joining me. And today's a special episode because this week is Black Maternal Health Week. And so if you don't know, Black Maternal Health Week runs from April 11th through April 17th here in the United States. And I'm sure around the world we can celebrate it. And it's just an opportunity to pause and think about our Black women, their maternal health, and what we can do and how we can think about ways to serve them better. Because let's just be honest, they have a hard time. They're not listened to. They're not well respected. Our Black women, especially our pregnant ones, are not highly regarded in the rooms where they are trying to give birth, when they're trying to get prenatal care. It is an awful, awful situation that they're consistently in when they're trying to get treatment, when they're trying to get care, and ultimately deliver a healthy, happy baby. And so this week gives us an opportunity to think about that, to acknowledge the struggles that Black women have, particularly in the prenatal world, and to just think about what we can do to support and help our Black women. Because the research is very clear. No matter what income, education, background, Black women, all ages, all income levels, all education levels, have the worst birth outcomes of anyone else in our society. It's just a reality. And Black Maternal Health Week gives us a chance to pause and think about what we can do to confront that reality. Just for a little background, this week was founded by the Black Mamas Matter Alliance, which is a nonprofit national network of organizations that focus on reproductive health and freedom, reproductive justice, birth justice, as they call it. And it celebrates during this week the activism that's taking place, the community that's been building around these issues, and working towards evidence-based solutions to deal with these issues that Black women face when they're pregnant. Because if you spend 30 seconds online, you will read some horrifying stories of everyone from your local nurse down the street to celebrities who have had horrifying birth stories because of the care that they've received or didn't receive and the lack of attention that's been given to them when they're in their prenatal state. It's just a reality. And on this podcast, we talk about environmental justice, environmental racism, environmental inequity, and we see it very clearly when it comes to Black maternal health, right? So the ways in which the environments that surround these Black women's homes and their workplaces contribute to these negative birth outcomes, the ways in which they're viewed by the public, the racism, the misogyny, all the things that come along with having to exist in the world as a Black woman leads to negative birth outcomes. The fact that many of our Black women, our Black households are found in areas of a city where there's no food available, there's poor water quality, the infrastructure is crumbling. All of these things, there's no hospitals, there's no healthcare facilities nearby. All these things lead to negative birth outcomes. And so we need to, at least first of all, acknowledge that reality. We need to acknowledge it. This is clearly disproportionately a Black female issue when it comes to maternal health. Because even as women all across the board face wide varieties of discrimination and misogyny and being othered in different ways, in the end, your white woman, your young white females, people from other predominant cultures, they take care of their daughters. They take care of their wives. They make sure that whatever's going on, their childbearing spouse gets what they need to deliver a healthy baby and then take care of that baby at the house, usually with a lot of support and a lot of help. That's not the case for many Black women, even ones with tremendous wealth and resources. The research has consistently shown us that when Black women go to the doctor, when they come in pregnant, when they come in with issues and health concerns, they're not listened to. They're believed to be exaggerating their conditions. They're believed to be exaggerating the pain that they're in. They're believed to be, exaggerating the urgency of the matter that they're dealing with at the moment. Consistently, the research has shown us that. There's these kind of racist ideas of Black women being like these superhuman, heroic figures that can withstand any kind of trauma, any kind of pain without medical intervention, right? There's this idea that Black women are dramatic and over the top and so expressive that you can't really engage what they're actually saying when it comes to their current health condition and health state. There's so many tropes and stereotypes and narratives of Black women circulating all around that it makes it very difficult for them to get the care that they desperately need because they're already at a disadvantage. They already live in polluted areas. They already have a lack of resources, financial, food, water, otherwise, that they would need to live full, healthy lives. They already lack that. And then they go to the hospital, they go to the doctor, and nobody's listening. Nobody's engaging what their concerns are. And it's tragic, and it leads to negative birth outcomes. It leads to distrust of the medical profession, medical professionals, and it leads ultimately to, let's just be honest, it leads to people not going to the doctor anymore. It leads to people not trusting the healthcare system around them, which is also detrimental, which also leads to negative birth outcomes. This is not something that can be taken lightly. This is not something that we can just brush aside and say, hey, get it together. Everything's going to be fine. Don't worry. You're overstating what's happening here. That's not the case. Black women need to be heard. They need to be listened to thoughtfully. Their pain matters. Their perspective matters. The way they understand the situation that they're currently in matters. And we need to ensure that people, especially those in the healthcare profession, and I'm talking physical health and mental health, need to acknowledge that when a Black woman gives birth and goes into a deep depression, for anyone else, it's just postpartum depression. We understand what it is. We support them the way we should. Black women, oh, what's going on? Come on, get up. You're stronger and better than that. Let's get going. Your child needs you. All these things that serve to negate the real and true and very common experience that comes from giving birth. We can't allow that to happen. And so, for me as an environmental engineer, obviously I can't help you with diagnosing your symptoms or understanding situations that you're in or having some medical intervention to support you during your pregnancy or post pregnancy or anything like that. But we can work harder to make sure that your environment is safer, right? That your environment is cleaner, that your environment is a healthy place to raise your family. We can do that. We shouldn't allow for our families, Black families, or any other family to live in areas where you don't trust the quality of the water, where the air is not breathable, where there's no access to food anywhere near you, or the only access you have is to the most unhealthy, salt laden, sugar laden snacks that you can find. We need to build and provide safe, healthy environments for you to exist in. And that's the thing that gets missed a lot of times when we talk about Black maternal health or any other type of health concern. The environment that you're in contributes directly to the kind of health outcomes you experience. The public health officials call it social determinants of health. It are these things that are in our society that are around us that contribute and in many ways determine the health outcomes you will experience. So it's not just your own personal behavior, it's not just your access to health care, but it's also where you live, your education. What are you learning? Is your environment safe to go to school in, to work in? Do you have green space, parks, hiking trails, biking trails, things that promote healthy activity? Do you have healthy food around you where you can go grocery shopping and make healthy meals for your family? Are you dealing with discrimination, racism, misogyny, xenophobia? All of these things, they can damage you physically and mentally and emotionally. These are all social determinants of health. We have to make sure that we're creating the kinds of environments that promote healthy living, thriving, and success for all of us, not these environments that continue to make it more and more difficult for you to take care of yourself and your family. And so that's one of the things that I want to make very clear on this episode. And as you think through Black Maternal Health Week, and as you think through the people that you know, the Black women that you've seen, that you've read about, that you either know personally or that you have some connection to, who have these horrifying stories about giving birth, about getting prenatal care, about getting medication, about being treated for different conditions while they're working through a pregnancy. Think about those social aspects also. Think about the environment. Think about the society that we live in and how that also impacts the way that women, Black women in particular, receive care and support. All of these things matter. All these things are important. And we should be aware of all of them as we talk about any of these issues. It just happens that today, this week, is Black Maternal Health Week. And so we're talking about that specifically. And I'll just be honest too. I mean, I'm married to a Black woman. We've had 3 children. We adopted our 4th child. It's a great, great story. But those first 3 deliveries, very difficult. The care that my wife received, very problematic. We were very fortunate. And I'll just say this, I'm not going to get into the details, but I'll say this. Both of our moms are nurses, registered nurses with decades of experience in various departments at hospitals, ICUs, cardiovascular units, heart units, cancer units, young children, older people, everything in between. They know all this stuff. So when my wife was going through her prenatal appointments, getting her care, they were with her and they were able to head off a lot of the nonsense that was coming from the doctors that she was seeing and a lot of the suggestions that they were making because they understood the healthcare industry, they understood medicine and pharmaceuticals and prenatal care. And so they were able to step in and say, no, we're not going to do that. No, she's not taking that medicine. No, she needs this and not that. No, they shouldn't be doing that procedure. No, we're not going to take that approach because they had that training and background. So we were very, very fortunate to have that. I know that most people don't. I know for a fact that Everybody doesn't have parents who are nurses who can step in and show you very clearly what should or shouldn't happen when you're getting treated. I already know that. And so, in light of that, we need to do the kinds of things that really, really support our Black women, especially when they're giving birth to our Black children. We have to support them. We have to care, and we have to recognize the challenges that come along with being a Black female. I mean, in America, but anywhere else, really, and trying to build a family and start a family. We've done a lot of different things to try to deal with that issue, with those issues, and there are lots of things that you can do as well. So, for instance, and this might be controversial. I know it's controversial. I know it's hard to think about it this way, but the researchers, the public health officials, the medical schools have all they've proven that Black female health outcomes improve dramatically, dramatically when they have a Black doctor. So that's the first thing I would recommend. And I know we want to pretend like we live in this kind of colorblind society and that all doctors are great doctors, and you can't just assume that being the same uh, color as your doctor is going to do anything for you. But unfortunately for you, the research says otherwise. Black doctors improve the health outcomes of Black patients. It's just a fact. And if you're fortunate enough to be in a place where there's a Black female doctor, you need to go for that Black female doctor. She's going to be highly qualified, well trained, and understanding of the experience that you would have had as a Black woman in your pregnant state. And she can engage you in ways that I would argue nobody else really can. And so that's the first thing that I want you to all know when we think about how we can support our Black women giving birth and otherwise. The second thing is to listen, like really listen and really take heed of what is being said and how things are being expressed when it comes to what a woman's experiencing and what they believe the solution is for that experience. Don't write it off. Don't ignore it. Don't presume it's something else. Don't just brush it off as ranting and raving because of some other issue. Really listen and really dial into what's being said because you can learn a lot. And at the very least, you can gain the trust of your Black female patient as you listen and as you engage in that conversation with an understanding that they know their body better than anyone else. They know how they're feeling better than anyone else. When you say, what's the pain level from a 1 to 10, and they say 9.5, they're not being ridiculous. It really does hurt that much. It really is that painful. Listen and allow them to express where they are and allow that expression to drive whatever intervention takes place. We have to do that. We should, and honestly, we should do that for anybody. We should all have that experience. I'm just saying it should happen here because it doesn't happen here. It gets ignored here. It gets rejected here. And so we need to do that. All of us, everybody. You listen. I'm talking to myself too. Like, oh, you're being so over the top. Oh, why are you being so ridiculous? No, no, no. They really feel that way. My wife really feels that way. My daughters really feel that way. Listen, listen, and you'll learn something. And when you go to the doctor and doctor's not listening, make that doctor listen. No, listen. This is what's really going on. Do it. Because that is what our Black women need. And that's what they should get from us, from people who are spouses, from their brothers and sisters and the children and everybody who's connected to them. Listen and care. Listen and care. And the last thing I'll say, because I'm not a medical professional, so I can't say anything really detailed about healthcare interventions for Black women, things like that. All I can say is we can help build a better society around our Black women. We can do that. We can go and fight against systems of injustice that continue to tear apart families, that continue to denigrate homes that these Black women reside in. We can do those things. We can do the type of work that cleans up the environment around them, around us, right? Picking up trash, advocating for more green space, parks, libraries, healthcare facilities, food stores, things like that. We can do that kind of stuff because that has been shown to also improve health outcomes for the people that live in those neighborhoods because our environment makes a big difference and has a big impact on what we experience and how we live and operate in the world. It's just the truth. It's just the truth. I wish I could say it doesn't matter. If you can get to the doctor and get some treatment, then you'll be fine. But that's not true. It's not true. If your water is unclean, if you don't trust the food that you're feeding your children, you gotta we gotta get out of there. We gotta do something different. We gotta fix what we have around us. And on that note, too, this is a side note. I just thought about this, but the products that are marketed toward Black families, Black women in particular. Let's just get real gritty, right? The cosmetics, um, the makeup, the hairsprays, the gels, all the things that we have pushed on our Black women to try and create what we believe is the ultimate sign of beauty and elegance. We know from studies now, tons of research has been done to show how many toxic chemicals are in these products. So many of them. They're so dangerous to expose yourself to expose your children to. We have to do something about that. We have to push for these chemicals to be removed from these products. We need to stop using these products. I don't know how you feel about it, how you feel about your hair, your skin, your body, but I don't want you rubbing toxic chemicals on your skin. I don't want you pressing your hair with toxic chemical agents because it's no good for you. It doesn't help. It doesn't lead to anything positive. And so all of these things are environmental justice issues. All of them. From how you take care of your body with products to the water you drink, the air you breathe, the school you go to, the place where you work, to the healthcare facilities in your neighborhood, to the way you've been treated by doctors that you encounter. All of these things are environmental justice issues, and they need to be brought to bear on the reality that Black maternal health is horrible, especially in the United States of America. It's horrible. And so for this Black Maternal Health Week, I want us all to stop and think, what am I doing to make my community, my environment healthier, safer, not just for me, but for the vulnerable, marginalized people around me. And in this case, I'm talking about the Black women who are pregnant who need our support and our love and care to get through the pregnancy, to deliver that beautiful baby of theirs, and to raise that child in a loving environment that's free from contamination and pollution, free from crime, free from all of the social determinants of health that would negatively impact their lives. We have to think clearly about this. We have to be deliberate and intentional about this. We need to advocate on the behalf of Black women everywhere who they already know that their health care is at best precarious and at worst racist and discriminatory. They already know that. When I saw that article a few years back, when Serena, who is, in my view, the greatest athlete of all time, she's tied for the record in Grand Slam victories. She is universally recognized as the greatest tennis player that has ever crossed the court. Phenomenal athlete, phenomenal intellect, phenomenal everything. She tells the story about how she almost died giving birth to her child. And I'm sorry if Serena Williams, with her resources, her physique, her intellect, her support system, her access, still could be close to death from childbirth, we have a serious problem. We have a serious problem. And many of us, myself included, don't have the resources that Serena Williams has. We don't have the access that Serena Williams has. And yet she's still fighting for her life to give birth to her child. So many Black women have died on the operating bed, giving birth to their children. So many issues. And so, look, it's Black Maternal Health Week. We pause, we reflect, and we ask ourselves, do we want to live in a world where our Black women, now these are women, look at the data. I read an article the other day. They're in colleges at a higher percentage than Black men and other groups. They're taking on more responsibilities at home, financially and otherwise. They're getting higher paying jobs. They're being asked to do more. They're being pushed into these environments where they're being pressured to deliver and produce. And then when they have a child, when they're pregnant, these are their health outcomes. You can't have it both ways. We're either going to support our beautiful Black women, help in any way that we can to get them the care that they need, the place to live that they should be living in, to support their families, to support the future, or we're going to let things go the way they are. And we're going to be okay with these disproportionate numbers of death in childbirth, these disproportionate numbers of complications in childbirth, these disproportionate numbers of complaints and problems during the prenatal process because of what we see in our society. I'm not going to stand for it. And I'm going to continue on this microphone, anywhere else I can, to at least bring awareness to the reality that our Black women in our society across the world, not just in America, across the world, are struggling to be cared for in ways that would protect them and their children. And so I don't know where you stand on this issue, where you reside on the idea of Black Maternal Health Week and the idea of pushing for solutions to some of these challenges that Black women face. But I would hope that as you do your own research, as you do your own analysis, as you read, listen to this podcast, look at the resources in the description of this episode, think through all of these different issues, and let's do something to make the world a better place for everyone, but especially our Black women and especially our Black pregnant women, and especially our Black pregnant women who have children that they are raising and supporting, loving and caring for. That's what we need to do. That's the charge. That is what we should all be focusing our energy on, especially during this particular week, which is Black Maternal Health Week. And so go out and make this world a better place for you and that Black woman next to you. All right? I hope you'll do it. And this has been another episode of the Environmental Justice Lab, where we are for the people and for the planet. We will see you next time.